went to the psychiatrist, and I was given Klonopin, which is a benzodiazepine, a different anxiety medication, Prozac, and something to help with sleep. 3 medications at 16 within 8 minutes. He had no idea what was going on with me, truly.
Welcome to Elevate, the gathering spot for first responders, their families, and the communities that support them. Hello and welcome back to the Elevate podcast. I'm your host, Kyle Goodknight, and I just real quick before we get into our guest, it's going to be a little bit different show today. She's brand new to the mental health field. She just graduated from college in this, and she's got a passion to help people, and she has some fresh perspectives. That's why we're calling the show Fresh Perspectives. So it's going to be really good to hear someone that has seen what she has seen inside of her collegiate career and how she's going to apply it to the world. And we've got a couple other curveballs we're going to talk about. But before we do that, don't forget to like, subscribe, share. If you're watching this episode and you feel that someone needs to hear this, please don't hesitate to share it with them and spread the word on the Elevate podcast, because that's all we're doing. We're trying to give people options and understandings of how us as first responders can deal with the mental load that we carry. So without further ado, Sarah Carter, nice to meet you. Well, I met you once before. We had our pre-call, so thank you for coming on the show.
Sorry. Thank you.
Yeah, and we she does she was the first time we had to have her on our show. She sent me a text and she's like, "Hey, I'm in the middle of dealing with a crisis. I've got to deal with this." I'm like, "Yeah, no problem." Like, hey, if you're out there helping people, fantastic. So, Sarah, go ahead and tell us about yourself, a little bit about your background, and then we're just gonna organically, discuss things from that point.
Yes. Well, like you mentioned, I am brand new. I just graduated with my master's in social work. So I'm fresh. I'm very new into this. But prior to this, it's actually a unique journey of how I've gotten here. I was set on teaching. I did 2 years of college in the teaching world, getting my degree in English and wanting to do that because I have a very strong passion for writing. I love literature. I love everything about it. It's always been something I'm very into, aside from what I do now. But I recognized strongly when I was getting into it and looking at what my career would look like that I did not have the creativity that I really wanted. And the creativity for me was very much deep rooted into conversations, emotions, everything around that nature. And it was so funny because I was doing all of the social work things while in college. I was doing a lot of volunteer work. I did mentoring for kids who were getting arrested through Juvenile Review Board. I've been doing that since I was 16 years old.
Wow.
So yeah, I was able to do it in high school.
That's a heavy lift, and as a 16-year-old, your brain's not even developed to deal with that stuff.
But. and I honestly, I credit the high school I went to for giving us those opportunities of going out and making an impact and having all these cool resources to do. I did some homelessness initiatives, creating a group within our school to raise money and funds for our community, because I did go to school in an inner city. So you saw, I come from a small town, very quiet, very country-like. I wasn't introduced to the depths of, folks struggling in poverty and having crises until I was in high school, and it was a massive culture shock. But I really learned during that I loved people. I've always gravitated towards everybody and anybody because I just think people are so cool. And that's kind of how I landed myself here. In going through the schooling process, I struggled with a lot of turmoil, not necessarily with the choice I made, but with how outdated we are being taught in our practice. And I think we very much are. And I will say, there's quite a lot of evidence-based, there's evidence-based practice where we're, very much engulfed with that a lot, but we're very much taught too that this is how you become the best therapist, is by doing it this way. And when I was fresh into my master's internship, because my bachelor's level work was more so, community-based, and you're doing stuff with grants and other things like that. Right. When I got my feet into, the clinical world, I faced a lot of that, where I was surrounded by folks who, it was the notion of, I've been doing this for 20 years, so I know what I'm talking about. And I was like, it doesn't stop when you get into this. The learning part will never stop. And
with technology and new findings and brain scans now that we have available to us. I mean, just real quick, I'm glad that you brought that up, because I've learned some things through my path of building the program that I'm building and my resilience program that there's stuff I've learned that I'm like, why wasn't I ever tuned into this? ACEs score, like what your ACEs score is and how it affects you, not only health wise, but your percentage of a first responder. If your ACEs, anybody actually, if your ACEs score is higher than a certain number, you're 500% more likely to kill yourself one day. It's like, wait, what the hell? And that's like documented. That's like actual evidence-based stuff, right? And another big thing that I did is I read, and I think we talked about this, is the Body Keeps the Score book. And it proved to me that we are still, in mental health wise, not just with first responders, but in general, we are still at our infancy in the medical field. We're having problems with people even saying that mental health is something that they can cover. I called up my flexible spending company. I said, hey, I can go get toothpaste with my flexible spending money. But I want to join a mental health course that costs $200. Can I use my money for that? It's my money. It's my health, mental health. Right. No, we don't approve that. You have to get it. You have to get a special message from your doctor, and you have to go through all these hoops. It's a form. Don't worry about it. We can do it. I'm like, but no, this is what I need now. I don't need it. I don't need to go to my primary physician to tell me that I need it, and it's antiquated. So I'm glad that you mentioned that, because I think that's one thing I want to make sure we focus on today is some of the stuff that you saw that could be better, and not only on the collegiate side of things, but I've talked to people that have been in this field and they have no clue what their ACEs score is. They don't know anything about childhood trauma, or it's sprinkled in, but it's not big. It's not a focus, and it should be a focus. Epigenetics should be a focus. Those things in our background has to be, especially first responders. I mean, we'll get into it later, but you mentioned to me 5 years dating a police officer, and that's a therapist and a police officer. That's pretty cool. I mean, I hope he doesn't reject your professional opinions, because it could really help him and his crew later on in life. But yeah, so talk more about what you've seen in your path getting up, and as you're now graduated and now looking back that you've seen. Just talk a little bit about that, and maybe an example or two that's not going to shun you from the industry. I don't want this podcast to get you in trouble. No.
Well, I've always been a very outspoken person, not necessarily to a fault, but I've always felt I had to apologize after too if I had a view that didn't align with somebody and they got offended. And I think, and it's not even so political based, because I think that's where people get things misconstrued a lot. It's just basic common sense and logic. When I sat down, and I don't have this idea that I'm better than thou. If anything, I get very nervous because I'm like, what am I missing in a lot? You could have a case right in front of you with a client and you're like, oh, it presents as this way according to criteria in like a DSM-5, or what, people are experienced with before. But I'm like, what if I'm actually missing this and I'm misreading that? Or what if the person's not really being heard and validated in this way and I'm viewing it completely different? When I took my first class, it was clinical assessment and diagnosis. I thought the professor was great, but something I very much had a hard time with, and I remember this, was I asked a question of, we were taught that you should have your diagnosis in the first session. The first session of meeting somebody, you should know exactly or around the guidelines of what they're being diagnosed with. And in doing so too, we were also expected to understand what medication was, what medications align with what diagnosis. And for me, I was kind of like, what the heck? Because I got into this because I don't want to deal with anything medical, the medical aspect of medications, of what, we have to have an understanding of it. But that was very a turnoff point for me. I like the talking piece. And for me, I mainly treat kids and adolescents. That's my forte. It's my gig. I love it. I don't necessarily dislike the adults, but if I had my pick would be very clear. And I had asked the question of, well, you only have a person for an hour in an intake session. That's an hour out of somebody trying to tell you not even the full story of what's going on with them. And misdiagnosis, I think, is so detrimental to folks who are really seeking treatment.
100%.
And I talk about my own experience a lot personally. The first time I sought out medication was when I was in high school. I was having massive issues with anxiety to the point where I felt like I couldn't function. I was a straight A student and I was falling off track and very much feeling, I think, at times agoraphobic and not wanting to, go and do certain things. But I had to force myself also to get through what I had to get through to get my diploma and everything else. But I tell people too the story of the first time I went to see a psychiatrist. I was in his office for 8 minutes, and I never forgot that. 8 minutes for my appointment as a first time, and I was 16 years old. I was driving. I remember I newly got my license, went to the psychiatrist, and I was given Klonopin, which is a benzodiazepine, a different anxiety medication, Prozac, and something to help with sleep. 3 medications at 16 within 8 minutes. He had no idea what was going on with me, truly. No clue. And it was more so just treating the symptoms and not looking at me as a whole and saying, well, try therapy first. Let's see what therapy looks like for you. And let's see if, let's speak to somebody to see, maybe you need that outlet rather than take this pill and it's going to get better.
Right.
And it didn't get better for me. I will tell you, medication has been the worst thing that has ever happened to me in my life. For some folks, though, they depend on it. But for me, because I got into the mindset of, oh my gosh, this one's not working, something else is going to definitely wipe it out and fix it.
Yeah.
And it was so hard. But I remember when I asked that question, reverting back in my class, my professor kind of looked at me and she's like, when you keep doing this for as long as, we've been like professors or folks who are seasoned in the field, then it makes sense. And you feel comfortable diagnosing the first session. And I will tell you, I never do. I just can't do it. Even in my profession now, we have leeway, of course, and we're expected to have like a treatment plan in 5 sessions, things like that. And I very much am to a T, like I'm at the 5th session when I diagnose because
well, that's actually pretty good. Yeah. I mean, 5 sessions, I mean, it could take longer, of course. And if it does take longer, then you put it in your notes and for your other people to understand it and explain it, and you have your background and you know why. So real quick, one of the things that you brought up, and it kind of, and this is how my podcasts go. I listen to what you say and then I'm like, ooh, I've got a question. So when it comes to our education, I think that's one place where if we bring it back to the first responder realm, and of course you probably talked to your boyfriend and 5 years, and so that's not just a boyfriend in my book. That's the beginning of a life mate. You know what I mean? So it's my son has been dating his girlfriend for almost 6 years, and I mean she's part of the family. I mean they broke up once and it crushed me. I think my wife and I cried for like 2 days or more. We're just like, oh my God, we're gonna miss her. And like they don't understand. Like, don't break up unless you absolutely have to because you hurt other people. No. But no, I digress. Sorry, I go off. I'm gonna try to get back to my point here. But when it comes to what we're not being taught in school, at least for first responders, have you had that discussion? I'm sure if your boyfriend, you said he's a little bit older than you, so he's been a police officer probably now for 5 or 6 years. And he probably did 5 or 6 years ago. He didn't get any training. I didn't get any training 27 years ago when I became into the industry. And what is your thought process on and what you're trying to do with I know we talked about you're trying to create a business eventually through this and be an entrepreneur and whatnot to help stuff. Like, I'm trying to get this education about these things that we need to know on the front end instead of the crisis mode. Like, is that anything that you've looked into or thought about, or like how to get this education into the systems or maybe into the police academies for your boyfriend's fellow
with his
officers?
academy? With his academy, I remember, I know crisis, de-escalation, that's a big thing.
But that's for the people. That's not for us.
Right.
That's what I mean.
For us, though, right. But with that part, they do have folks that have come in and they talk about mental health, but it's only with the general public. This is what you probably will be seeing, but taking care of yourself wise. With him, no, he's never mentioned anything, and I always found that difficult.
Well, he probably didn't have it. Yeah, he probably didn't have it. I know I didn't have, and 99 point, like, they're just now starting to sprinkle it into the EMS industry, where the National Registry, which is 2 miles from my house here in Columbus, Ohio, the National Registry is starting to tell EMS departments, now this doesn't fall into police and fire yet, maybe a little bit of fire, but definitely not dispatchers either. And it's one of those things where they're starting to say, hey, you need to train on the first responders' mental health, but nobody knows how to do it. So, like, I'm lucky enough that I'm going to be granted a time in a class in August, and I'm going to go in and teach my program, which is right on par with anything I've ever heard nationally. So, but are you having aspirations of that, or discussions of that, or thought process of doing that for for not just first responders, but just to get back into the schools and say, hey, listen, you're antiquated. Like, what can we do here?
I'll tell you, I worked in school systems for about 4 years. So I started doing, curriculum development with extracurricular programs, and then I did a bit of school social work. So in that realm too, I think it all starts in our children. I'm very firm on that. I think the way that we discuss anxiety, it doesn't come out until you hit these higher levels or of education, or if you're in the field or in, your adulthood is when it's really discussed. I
Yeah.
don't think that we do a great job about that. I think because, again, there's expectations that health, in a health class is focused on, certain things and not
Physical.
certain
Yeah.
things.
Yeah.
But in talking with Matt, and he knows I'm doing this, he gave me full disclosure to do, say and feel however, because of course I have to be, protective over that. But
Right.
the thing I absolutely that sets him aside and that has made him so unique is he is the most social worky cop I could describe.
Nice.
Very quiet person, but just so down to earth and very in tune with people and their emotions. And he even the first time I met him, I remember, and I tell everyone this story, he didn't tell me about his career for months. I had an idea that he was doing, because he does 2 different kind of gigs, and I didn't know about the police thing for months because he was afraid that I wouldn't want to date a police officer. And, but when I first met him, I thought like, oh man, and I was trying to convince, I was living in college at the time, my roommates, I'm like, yeah, I don't like him. And I couldn't describe why I didn't like him. I really liked him. I was just afraid of it not working out because I liked him so much. So I was trying to self-sabotage before it even evolved.
Yeah. You're filling in your own self-belief. Yeah.
Yeah. But he, in his work with people, and he and I have this conversation all the time, and I tell him, I'm like, oh my God, I could never do that job. And he's like, well, you in a way you do, but he's like, I don't think I could do your job because you're in the office all the time. And he's like, I get to like move around and do things, but I think for him, what he loves is the interaction with people. He's, the stories he gets to tell and the things he sees. But I think I will tell you, from a perspective as somebody he's an intricate part of my life. My family considers him as a son, and I'm very much enmeshed into his family too. And it's been the best thing that's ever happened to me, but I consistently worry about mentally, is he not telling me how he's really feeling about something? Is it, is this really bothering him? And I have no idea. Am I not picking up on this because I'm carrying whatever I went on through the day and going home and trying to deal with that on my own? And it's a lot, and the dynamic I think between the two with him is it's the brutal honesty. He's very honest about how he feels about things, and he's very honest about, wow, I saw this today, and he's very physical in symptoms. It's interesting with him. Like if he sees something, children cases I think bother him quite a bit, without a doubt. That's common. Yeah. Physically though, I know that there was one case that he had particularly where the house was like a house of horrors, and he was vomiting when he was like coming out of the house because he was so disturbed, and it bothered him for days. He was like, I just couldn't get what I saw out of my head and things like that.
Yeah, trust me,
and
you'll
smell
never forget the smell.
Oh, yeah.
You'll never forget the smell. I mean, I've had, weird things that, and that's one thing too about the first responders when it comes to the 4 or 5 different first responders we have. We have law enforcement, we have corrections are part of the first responder realm, dispatch, which don't ever get to see. They just sit behind a phone, so their issue is no closure and not being able to physically put their hands on a patient and help them, and then to realize that what they're helping mentally is just as good, but that's a lot harder ask, right?
Yeah.
Like I can go and be like, hey, you're not breathing good. Let me give you a breathing treatment and do something physically and say, hey, I just helped him and look at it, he's breathing better. That just happened yesterday. So, and then of course we've got EMS and fire, and they're kind of EMS. Like I am not a firefighter. But I work with firefighters, and but a lot of firefighters, they have to be EMTs. Most of them in my area are paramedics as well. But so police or fire and EMS are kind of, when it comes to the medical side of things, we get some training where like police officers don't get that disgusting part. Like they don't get to see the
Yeah.
disgusting stuff. They do, but they don't know how to process it because they're not medical. They're in police officer for a reason. I'm in medical and deal with sputum and blood and guts
Yeah. Yeah.
because I
Yeah.
can handle that a little bit. You know what I mean?
Yeah.
And some police officers like, nope. They faint when they get their blood drawn, for
That's him.
drug tests when they get trapped. So it's like, it's not, it's one of those things where they're just not built that way, but I'm not built like a cop. You know what I mean? There's no way I could be a cop, but we're still first responders. So for them to see what they see like that and then have that scarred in their brain for life, they'll never forget that. And they need an avenue to get it out. And with him having you in his life, that's perfect as long as he exercises that and communication, huge, like the fact that you guys actually talk about stuff without violating HIPAA is great. I'm married to a nurse who is a pediatric nurse. She hears and sees things that are just god awful. Even being in the office setting, she can't divulge like specifics, but she'll come home and be like, listen, today was a rough day. I just need to let you know. Like there's that open communication. So talk a little about the open communication that you and your boyfriend have, and if that's helped, or if that's something that you guys do, and how that's helped him and helps you in your opinion.
Well, I will tell you, it's kind of ironic. I think I've had to do more work in the open communication part than he has in many ways. And I think the realization to that came this past winter. There was a day, I was in clinical field placement at the time, and I was having a really just one of those days. And I very much can keep myself in check. And then when I leave, I get upset when I talk about things because I try to, get through the day as best I could. It was like a physical response. I had a kid and I felt who I had first session, and the session was just so nauseating for me because of how disturbing it was. And I got up to, I had called him earlier and he heard through my voice on the phone, even though I was like, I'm good, everything's good, but he knew I wasn't good. He just knew.
Right. Yeah.
And he showed up.
We all know. Yeah.
Yeah. And he showed up to my office with lunch, and I didn't expect him to go. And I was going down the stairs, and he was coming up the stairs in the building. And I just remember I just started sobbing out of nowhere.
Yeah.
I was just like, oh my God, I can't do it. And I couldn't even it was just like chest pain. It felt like I was having a heart attack. And I just had to remember, I picked the wrong career. I picked the wrong career. And I totally freaked out. And so I know, and I felt so bad after, because I'm like, I had colleagues who witnessed me have this moment, but it just everything just melted on the floor. And I think in that moment, when and he had said something very bad, he's like, well, I don't know what you're experiencing because you don't tell me a lot about it. And I'm like, I leave and you're so fried because you're dealing with people and talking all day long and having to think,
relive it
all day long. And I'm just trying to go home and do something fun to get my mind off of it. But, the open communication part is a lot of where I struggle, because my anxiety is very much, I hold it in. And when it comes out, I get very irritable. And irritability is something I hate being because life is just fun for me. And I I'm very outgoing and giddy, and I try to have a good time, but I get very irritable, and I start to get to a point where I just snap. And I think, but with him, when the anxiety hits, it's very much, I know when he gets amped up, because he definitely, he's fun and he's goofy, but he gets all jittery, oh, do you want to do this today? He has to be busy all day long. And I know he's doing that on purpose to not think. Yeah. But the open communication part is all in body language. I'll tell you, Kyle, I think the body language piece is huge. I think even in professional work and personally in our lives, the people around us, I think people feel that you need verbal innuendos, or people need to have conversations to understand. And I think if we take the time to step back, because it's so hard, we're all busy, we're all immersed in life doing our own thing, to really watch and say, wow, that person's off, or something's not 100% right. That's huge.
Well, and in our industry as the first responders, when our partners are off, that, what does it matter to you? Well, he's driving me really fast to a scene. That's why it matters.
Yeah.
And then my life is in his hands, and he's not on. And so it makes sense. I mean, we talk about nuggets all the time, little nuggets that are sprinkled in that come out in these episodes. And you just hit one huge that I didn't even think about. I've never, if I have discussed it or understood it, I've never put it to the forefront of my mind. But you said the body language of your response mechanism is a huge factor. That's the nugget. That's an important message, everybody. And like I said, Sarah Carter may be new to the field, but she's wise beyond her years. And I noticed that the first time I talked to her. That's why I wanted to have her come on and come on the Elevate podcast. I know she's not a first responder, but the tie was that she's married to one, or not married, maybe soon. Sorry.
One day.
Maybe. Yeah. If everything goes right. But it's just one of those things where I knew what talking with her and in that early relationship and the dynamics of a police officer, that something would come out that was going to be helpful. And not that everything isn't helpful, but body language after an incident and how you come home. Because that's another thing about the Elevate podcast. It's not just what we do on scene. It's not what we do at our job. It's when we come home and present ourselves to our loved ones. How are we doing it? And the body language is so, that just like, it gave me chills when you said it. So
yeah, absolutely. And I think too, I mean, and therapy, for me, body language, I think, ties in a lot more in what I'm physically assessing somebody, especially children, because children, they're very physical. Yeah, it's their emotions are very physical. And for myself, like it hasn't taken me until my 20s to do some real work on what I feel when I'm really worked up and what it looks like for me. And I have to rely on other people and what they're seeing, because I will very much push it to the side. I will tell you, I had a colleague, a month ago, I was in a staff meeting. And I don't love staff meetings because we sit round table and I feel like I'm on the spotlight and I'm sitting there and it's like I can't hide. It's like, and when I'm in these meetings, my hands are cold and my heart always goes like, it feels like it's going to like fly out of my chest, but I get all splotchy. And I brought that home and I said to him, I'm like, she said I got this like weird rash. She's like, yeah, every time I'm red in the neck and in the face. Like I get these like splotchy, not even like hives, but I'm itching. And I'm like, oh my God, like I didn't even realize that. So it's things that I don't even dip into that he recognizes. The thing with him too. Yeah. And my mom is a psychiatric nurse practitioner. So there's an interesting dynamic within this whole family unit of mental health.
Right.
And she had said to me, we had went to Universal on a trip one year, and she was like, he's so interesting because he scans everything.
Well,
and I'm like,
he's a cop.
Yeah, but like to a T, yeah.
And that's a problem. Like that's something we talked about a couple of weeks ago at a big symposium, is that cops are never off. They're always on. And the question was, the guy who was up on stage talking, he said, who's my couple in here that are cop couples? Who are they? A couple people, and there was somebody closer than the other people. And he's like, so who sits with their back to the door? Or who sits with their who sits facing the door? And they go, the one with the gun at the time. If we both have guns, we just split it. We just deal with it. And he's like, you're always on. You're hyper, and you never come down off of that rush, off of that adrenaline. He's like, you know what? Yes, there have been incidences in this world, but how many times have you guys gone out to dinner and anything has happened? And how many times have you been married? How long have you been married? And they said it. And he's like, so we're looking at over 450 times that you guys have gone out to dinner in your relationship, and not one time did someone come through the door and try to get you. So peel off of that hype. What do you call it? Hypervigilance. That's the word he used.
Yeah.
It's that hypervigilance, which is like you said, your boyfriend goes to Universal and he's hypervigilant in the moment. He's supposed to be enjoying Universal. Like we don't understand that we can go into action in a moment. We can go from 0 to 100 miles an hour with our training, that we don't have to be hypervigilant. You see what I mean?
Yeah.
So
and I think with him too, like the outlet, it's so funny because even with him like that, I'm like, how can you enjoy it? But for him to get through his, job and to look forward to things, we're massive Disney fanatics. We've been Disney fanatics for.
We just got back.
Yeah. Did you? We did too. We went.
Yeah. We were there in May, like early May. So
we went just like last week. We just got back.
We went. I think the first week and a half of May. I think we got back on like the 13th or something.
Yeah, but it's always like when we go, it's the realization, and we're very much big kids at heart. We're always going to be that way, but it's like you don't have to worry about anything when you're in Disney World. You're worrying about which snack do I get here and what ride am I going on next.
However,
and the day before when we're packing up to go home, we get so sad because it's
Yeah.
a realization like
It's
you have to
the
in
day before you go
anything.
home. It's still like a depression. You're like, oh, it's
Yeah.
Disney depression. So you say
Yeah.
that, but and like I said, and this could be something that you share with him, so he's not on that hyper vigilant stage all the time,
Yeah.
because I've learned about that, and medical, only medical. When it comes to what the police understand, that's different. I have some vigilance when it comes to like safety and stuff like that, but
Hmm.
not as well trained as a police officer, right?
Hmm.
Um, but and so it's a little bit easier for me. However, I know that through my life, I've had situations where I've turned the corner onto a road and, oh my God, there's a car that just flipped. All right, well, it's go time. It was like
Hmm.
instant, like instant. I knew what to
Hmm.
do. I knew how to assess. People were on 911. I was telling them what was going on so they'd have a
Hmm.
paramedic on scene with like really stuff. We've had a car flip on the freeway coming back from vacation one time. And at Disney, when we were there just this last time, it's pouring down the rain. We're running from our hotel into the food court at Pop Century.
Yeah.
I run through the 9 and the 0 of 90. I like squeeze myself through. Right there's the door. I open up, and as soon as I walk in, this kid pushes back from his chair, and he's going, and he can't. Yeah, and I just
Yeah.
went around him, and I grabbed him. I'm like, man, are you okay? And I think I startled it out of him. I didn't actually get into a full Heimlich, but then
Yeah.
he was like, and he spit food all over the table,
Mhm.
and it was just like it was instant. So let your
Mhm.
boyfriend know that he's going to be able to act in a moment. If he peels away some of that hypervigilance, he's going to be able to make things happen because his training is going to kick in because he's so used to it. So I don't know. I
Oh,
digress.
totally. 100%. 100%. But it's just little things that I don't recognize that I would find. Even with him, the biggest thing that I find we have frustrations over is I'm a planner and he's very
Uh,
spontaneous.
yeah,
But his job is very spontaneous. You don't know
absolutely.
what's
Same
going to
thing. Yeah,
happen, you know?
I'm the same
Yeah.
way. Yeah, I'm the same way.
And but I mean
I'm
for
a
me,
little of
like I
both. I'm a little of both. I like to like
Mhm.
certain things I have to plan out, like when I do construction or a
Mhm.
podcast or anything like that, or helping someone learn, build a podcast.
Yeah.
I
Yeah,
like to
yeah.
make sure that there's a plan and we try to stick to it because if not, you don't progress, But
Yeah.
but I also am very very spontaneous. But yeah,
Yeah.
I wanted to. So thank you so much for coming on.
Yeah.
The Elevate podcast. I appreciate everybody tuning in and learning about you and learning that yes, we have hope in this world for the younger generation to actually give something back to us and not to just write people off because they're new, because even and Sarah's proof that she has been in this space since she was pre-16, right? And then with her
Mhm.
own issues, that's a lot. So,
Mhm.
you're already looking, yeah, you may not have had a job in it, but you were doing it as volunteers and you have
Oh yeah.
experience. That's still
Mhm.
experience. I mean,
Mhm.
when I was a teenager, I was dealing with handicapped people for my neighbor at Special
Yeah.
Olympics. I've got experience in dealing with handicapped people
Yeah.
from stuff that way. But the other
Yeah.
thing too, I want to make sure that we cover and that other people that are listening that may be more like Sarah and more in an office setting and maybe hearing the stories and hearing what's going on. One thing that she mentioned that I just want to touch base on real quick before we go is the fact that you are you are 100% susceptible, like a dispatcher, of that vicarious trauma. So,
Mhm.
you know, dive deep into vicarious trauma treatment. Just make sure that
Yes.
you know how to communicate with your boyfriend, communicate with your family, communicate with yourself about this vicarious, because it's
Yeah.
real vicarious
Mhm.
trauma. I had a dispatcher that their training was just listening to calls, and one of the calls
Mhm.
they listened to was a school shooting to train them. And he said, I
Yeah.
still wake up. He goes, I wake up with nightmares about school shootings because of that call. He goes, I wasn't even
Yeah.
on it. It wasn't even my call. It was a training
Mhm.
call. So vicarious trauma and secondary trauma is absolutely 100%. Survivor's guilt, that kind of stuff.
Yes.
That's very, very much, and you hear some of the worst when it comes to kids, which really
Mhm.
affect us. So just know that that's what it is. Anybody listening out there today that thinks that, oh, just because I'm listening to it or I hear a story about it doesn't mean that it should affect me. Absolutely, it can affect you, and do the right thing and take the right steps. So, any last words, Sarah, that you wanna mention? We'll do that, and then we'll sign off, and we'll get this episode running.
Yes. Yeah, I think just, if you're new into this, don't have, reservations about speaking your mind. And
Mm,
I think the biggest thing in anything you do, first responders, mental health, any profession, is delve into the lifelong learning. I think what will permanently scar this profession and really cause detriment to society is continuing with the narrative that if you are well seasoned, that if you've been doing this for so long, that you're the expert. We can't be the experts. We're never going to be an expert in any of this. It's so evolving.
It
There's
is
100
always
things
evolving.
I could think about that. I'm like, I don't even know 100% how I would approach that, and just swallow your pride, because when you get into this, it is such a shock. And I will tell you that, what my future looks like with this, I'm not 100% sure. I think this is why I'm pursuing this avenue, because there might be a point where I'm like, yeah, this is a bit much. But this job, I think, is so beautiful in many ways, but it's also quite stressful and painful in other ways too, and having recognition into that and delving deep into yourselves and other people as well, but realizing that it's very creative too. But the creativity comes from understanding that we can't have the answer to every single thing, and don't trust, textbooks and things. Don't take it for face value.
Right.
Don't take that for face value. The things that I have read, I'm like, this is so ridiculous. And the realistic, me sitting down and using the same verbiage with somebody, they would look at me and be like, I'm never coming back because this chick is robotic. Like, they can't do that.
Right.
So just be creative. I think that's the biggest thing in all of this, for sure.
Awesome. All right. Well, thank you so much, Sarah, for coming
Thank
on.
you.
And thank you, elevators. That's what I call our listeners. I call them our elevators. So I appreciate you tuning in and listening to our episode. As like always, all the episodes, I really appreciate you. Don't forget to like, subscribe, share the episode with someone if you feel like they need to hear it. And go ahead and, if you have any comments, go ahead and write them in. And, those questions will be generated towards our guests, towards me, what have you. We'll answer them as best we can. And, of course, don't forget to make sure that and check in on your coworkers and check in on your loved ones that are first responders, because they're okay with talking about stuff. They need to be okay with talking about stuff, and sometimes they need just somebody to know that, hey, I care about you. I see you had a bad day, and let if you don't want to talk about that's fine, but I know that your body language is showing me that things aren't good, and I understand that, instead of turning in and be like, why are you like this? Don't you train for this? And I'm like, so just be more understanding and graceful with that. So we appreciate everybody. Sarah, thanks so much. Take care.
Thank you so much. Take care.
That's a wrap for this episode of Elevate, brought to you by Frontline Empowerment Solutions, your partner in building resilience and fostering continued growth. If you found something valuable today, don't keep it to yourself. Share it with someone who could use it. Don't forget to like, subscribe, and hit the notification bell so you never miss out on our next conversation. We're here to bring you more stories and insights, all aimed at strengthening the first responder community. Together, let's keep elevating each other, one episode at a time.